Today on Trey Hart, I'm going to be answering some questions about medications and clinical trials. Stick around. One of the questions that sometimes is asked to me is, how do I know that the doctors are treating me with the appropriate medications? And the truth is that is a very hard process, and that's one of the things that I'm going to talk about today. Fortunately for us, there are many tools available that the doctors can use to ensure that the medications that they're giving you is the appropriate ones for your conditions. One of the most common things that they use is data from clinical trials. Basically, when a medication comes out and it's new to the market, or even if it's been out for a while, to know whether it's the most effective or better use for particular patients, doctors will refer to the clinical trials that were involved in making the medications. Today I'm going to be talking about the clinical trials and what they are, and a little bit about how they can help influence the doctors, and about how you can help with the clinical trials. One of the things about clinical trials is that any innovation when it comes to medication is not derived in weeks or even months. It's usually in a matter of years. So anything that's new has to start with some of the basics. Even before they start working medications with humans, they will usually test them on animals to make sure that they're safe to be trialed in humans. And then once they begin their trials in humans, they will usually start out with a small group just to make sure that there's no adverse effects to the humans, and then they will progress onto larger groups. There are several different type of trials that can be done. One of these is called Prospective Trials, which patients are identified and then followed over a period of time to see how a medication will affect them. The other one is called Randomized Trials. In randomized trials, there are a group of people. There's usually two groups of people. One is receiving a placebo, or basically a medication that has nothing in it that's going to help them and is not going to harm them. And the other one has the actual medication that they're trialing. And they'll compare the effects to the two. And then there's some trials called crossover trials, where a patient will receive the placebo and then it will cross over into the actual medication, and they'll see what the differences are. And then the other type of trial is what they call a double-blind trial. A double-blind trial is where they are trialing medications in which neither the patient nor the nurses or the people that are involved in giving out the medications know whether it is the placebo or whether it is the real medication. And that the double-blind trial is helpful in the fact that because nobody knows what it is, they're wanting to see if the medication has a better effect than the placebo effect. Now, when it comes to trials, there are different types of trials as well. One of them is treatment trials to see whether a certain medications can treat the disorder. The other one is prevention trials to see whether certain things will prevent a disorder from happening. Some of these are diagnostic trials to see if they can diagnose a condition. Some of these are quality of life trials. Basically, they want to see if your quality of life is improved. And this will usually affect two things, and the two things are morbidity and mortality. Morbidity meaning the effects that whether you're having to go in and out of the hospital more frequently or less frequently, and mortality is obviously whether or not more people are are dying or less people are dying, or if it makes no difference in relation to those. There are different phases to some trials. Usually phase 1 involves very small group of people, and the phase 1 trial will basically see if there's what side effects that there are in relation to a small group. Phase 2, usually there's a larger group involved. The larger group involved, usually around 100 to 300 people. And this is just basically to make sure that, to see its effectiveness and to make sure that the side effects aren't harmful. Usually they'll go from phase 1 to phase 2. And sometimes they'll skip on to phase 3 trial. Now, phase 3 trial is one that usually involves 1,000 to 3,000 people. And this is a trial that hopefully crosses a broad range of male, female, of a broad range of ethnic groups, any of those groups. And hopefully in the larger groups, there will be a broad range of people involved so that they can get the best data as to whether in those individual groups that might be involved, whether it's effective towards them or effective to them. There are challenges, obviously, to any clinical trial. The challenge is getting people to participate. And if you want to know whether you should participate, my simple answer is this, is if you're offered the chance to participate in a clinical trial, I would take it. Now, some people say, well, what if they give me the placebo drug and whatever, they're not going to tell you whether it's the placebo or the real drug. But the great thing about trials is they're not going to do anything that's harmful to you. So whether it's placebo or whether it's the real drug, if it appears to be harmful to you, they will immediately stop what they're doing and will resume basically what you had before. So the great thing about participating in the trials is the more people that participate, the greater chance that they will have of being able to treat more people in the future. Especially in, whether you're an ethnic group or whether you're female, all of these things need to be addressed, and the more people that participate, whether you're an ethnic group, female or male, the more the knowledge that the researchers are going to have to be able to treat people in the future. Hopefully this will have answered some of the questions about, how does my doctor know what medications are useful for me? Basically what happens is when a medication comes out and it's been through these trials and it's marketed towards a particular thing, say for instance hypertension, doctors will review data that's in relevance to that medication before they give it to their patients. And so this is how they know what medications might be helpful to you. And the good thing is whether the data is out there, if the doctors are giving you something new, they will also monitor it. And there's reporting systems that they can report to, the drug companies, the FDA, or the countries that have monitoring agencies. They can report to these any adverse events or effects, so that if other people are going to be affected, they can notify them. So hopefully this has been helpful to you. If you like what you've seen, please put a like, and if you're new to my channel, please subscribe. Thank you.